Let's move to this now. The Minister of Health, Dr. Joe Phaahla, delivered a keynote address at the World TB Day commemorative event in Evaton with the aim to build public awareness about the global epidemic of tuberculosis and the efforts to eliminate this disease. For the latest on this, let's cross live now to our reporter, Katleho Sekhotho. Katleho, give us a snapshot of what's transpired there so far, including those demonstrations that we saw earlier.
A very good afternoon, Nhlanhla. Indeed, we saw the commemorative event here unfold in Evaton for the World TB Day. The keynote address there being given by Health Minister Joe Phaahla, and basically the minister mainly highlighting the need for 4 billion rand to really meet the target of 2030 to eradicate TB as a crisis in South Africa. But what we also saw, as you rightly mentioned, Nhlanhla, the picket, if you will, by SANEC members of the South African National AIDS Council there, just highlighting some of the issues relating to funding of the organization, and without the proper funding, they will not be able to function. So a forum around SANEC just rallying to make sure that they highlight the issues of funding for the organization to the Minister of Health. But I have with me the Gauteng Health MEC, Nomantu, Nkomo-Ralehoko, to give us more as we reflect on today's events. MEC, thank you for your time. I mean, let's start off with that picket. Just your reaction to it and the members there raising their issues as it relates to the council.
No, indeed, they indicated to us that they are going to picket. Even yesterday we met with them, they gave us a memorandum that had part of the issues that they are raising. And funding was one of those issues that they want government to address it. It was myself, the Premier and the Minister, even when we were meeting with them, because we had build-up events with them, and they indicated that don't be surprised because we still want to insist on this issue of funding. Besides that, there are other things that we are doing as government, but we believe that if we can have more money and that can be channeled to us as organizations, that will help us to be able to move around and assist and do work with yourselves as government, because they don't want to be excluded to the work that we are doing, and we are happy that we have been working very closely with them even in Gauteng. You have seen the build-up events. Even now there is that blitz that is going to be done. They will be part of that blitz because they still insisted that we must end TB in the province and in the country.
Absolutely. Now, MEC, we heard from the minister, the pledge or the agreement that USAID would donate or contribute $94 million, that also contributing to the overall 4 billion rand that's needed. And the highlighting of that money needs to reach communities. What kind of strategies are in place to make sure that the money goes to the right places?
Already we have been working with USAID, so we have systems in place that we are going to utilize, that we have been utilizing before, because this is not the first time that they are giving us money. So they have been giving us money. They have been assisting in our clinics, in our local clinics, especially working with our district offices. You know that in the province we have 5 district offices that are led by the chief directors, and we have a team and a pool that deals with local promotion programs that works very closely with them. If you follow us as you always do, you will find that every day we are out there in the communities channeling awareness, education programs to communities, and part of those is screening that we are doing with USAID, and we are checking our patients, we are following up to our patients. Those who have lost them in the system, we bring back again in the system, because that has been the key problem that we have been experiencing in the problem of those that default, and we go and get those defaulters back to the system again. So it will help that money, but we will definitely utilize it properly, because there is accountability that we must do once we receive that money. It's unlike that you grab your little rent and run away. So we'll still be accounting, reporting to them, working very closely with them, including those NGOs that will be benefiting from that money that comes from USAID.
Now, MEC, some of the stats that we saw from the World Health Organization, 2022, particularly where we saw over 54,000 people die from TB, over 280,000 falling ill. In terms of the fatality rates, it seems a challenge to bring that down. I mean, what's the immediate task that can be implemented to bring that rate down?
We have to make sure that we preach the message of prevention, and we must bring them closer to us so that they know that we are part of this. As we are saying, yes, you and me, you and I can end TB. So that must be practically done now. But you have realized that again, women are the ones that the number it was sitting at 2.8%. It's men now that we must go deeper in terms of dragging them to come to our clinics, to come to our hospitals, to come to our communities. Good thing you have seen that we're working very closely with the religious leaders as I'm heading the faith-based organizations in the province. We're even using churches now to distribute some of the medication to the churches, which is one of the good things. We're working with the traditional leaders. We have seen even the Deputy Minister, Katleho Sekhotho, that is part of us because he is encouraging the religious leaders to work very closely with us. So we work with everyone now that can assist us to deal with this problem. Hence I was saying, if it needs us going to the ship-ins or somewhere where men are gathering, let it be so that we can make sure that we send this message loud and clear to them. Men are scared of presenting themselves to the clinics. If you have seen even during COVID-19, most of people that we struggled to assist were men. Even here on TB now rate, you can see that women, the numbers in Gauteng are very down. It's low, 2.8%. But on men, it's high, it's around 8%. So which means we must intensify our programs moving towards working with men. All these men's organizations want to appeal to them. They must be part of us, assist us to ensure that we reduce the levels of TB in our province and in our country.
All right. And just a last one, MEC, we know the stigma around TB still persists, and one might be confused if it's a curable disease. Why do you think this stigma persists, and your message to the public in this regard?
I know that it's one of the issues that you feel that there's something wrong with you when you have TB. You think that you will not be cured. So I want to appeal to the public that TB is curable. If you have been told that you have TB after those tests that we have done, make sure that you just take your medication. Your 6 months treatment, you can stay in the hospital because we have our hospitals that are designed for that in the province. So we'll take you to Sizwe so that you sit there and we will treat you, we'll give you counseling again, because part of the things that we're intensifying now as a Department of Health is to counsel you once in any other disease that you have. Because if you're not being counseled and there is not that communication that is done to you, you are on your own, you'll end up losing hope. So we are now busy with palliative care that we are doing, of training even pastors with the University of Vets so that they can have some skills of counseling our citizens so that they can understand that any other disease that you have is preventable, but it can be cured.
Thank you very much for your time, MEC.
Thank you.
Thank you. And Ntlanhla, you heard it there from the Gauteng Health MEC, just outlining the interventions being made to try and change the stigma and to really keep people on treatment. And the departments, and I guess the national departments, aim to really eradicate TB as a problem by the year 2030. And also taking home the message that SANEC brought here through their picket, and just acknowledging the concerns they've raised as it relates to funding of SANEC and in the sector, and that without proper funding, NGOs, civil society organizations will struggle to do their work.